Welcome to INS TV. We have with us today the Dutch Health Minister, Mr. Bruno Bruins. Welcome, sir.
Thank you. Thank you for the pronunciation. Very well done. Bruno Bruins.
Sir, India and the Netherlands are collaborating in the global fight against antimicrobial resistance. And there's a pilot project in Andhra Pradesh, Krishna district. Could you tell us a little bit about that, sir?
Well, we are very keen, and we is also from the Indian side, but also from the Dutch side, to be very practical in our projects. So in this AMR project, we try to work together with a coordinator from the Dutch side. We have appointed a Dutch coordinator especially for this project. And I understand that also regional coordinators are appointed here from Andhra Pradesh. That's a very first step, very good. And we will exchange the knowledge from the Dutch Institute that we have especially for AMR questions. And we hope with that we can then build a train the trainers program in order to help people also in Andhra Pradesh. What is helping us in the Netherlands is that we took the One Health approach. So trying to make one policy, not only for humans, but also for the animals and also counting the environment. So this One Health approach, that's something we want to share with people and maybe especially with farmers from India. Because what we want to prove is that it is very clear that there is a good combination of making a living and also using less antibiotics.
And what are the diseases that come from this AMR? Which are the diseases that...
Or it can be all kind of infectious diseases, and that can lead to severe illnesses and even more heavy. And I think what we are trying to do is trying to tackle a worldwide problem, because antibiotics, they are everywhere in the world, and what we need is to open up this problem and to share information, to share knowledge, and make sure that we work together, because when every country does like this and is not able to share or is not willing to share information, then the problem will become even bigger. So I very much welcome the cooperation that we have with India.
And how can India and the Netherlands collaborate to provide affordable and accessible healthcare to all, and especially in the field of e-health? How can Netherlands help?
That's a very interesting question. I think the program, you call it Ayurat Bharat?
Ayushman Bharat?
Ayushman Bharat. Sorry, my Indian is not that good. Ayushman Bharat. But I think it's a great program in order to achieve that the underprivileged people in India can make use of medical care as well. And I think this is a very good issue that your Prime Minister has taken up. And well, in the Netherlands it took us decades and decades to make a good health system. And even we in the Netherlands built the system that we have is not longer than 15 years available in the Netherlands. In this Dutch system there is a good cooperation between private parties and the public government, who sets the rules and regulations so that it is clear what are the tasks and the obligations for the private parties. But on the other hand, the private parties, they can work and they can make a good business within the system. And I think that is especially true for e-health solution, because you can understand that everybody should be able to visit a doctor, but when the doctor is not close by and you need to see the doctor, maybe to see the doctor you can use telemedicine. You can have a long distance connection with your doctor. So we are trying to implement this in the Netherlands, and I can imagine that this is also for some areas, maybe some remote areas in India, it could be very useful. And this comes with affordable and accessible healthcare, because it is accessible, because then you do not longer need to go to the doctor for every single issue that you have. But on the other hand, it is affordable, because it is very cost-wise to organize a doctor in an e-health solution way of working.
Is the Netherlands collaborating on the Ayushman Bharat program? Are you helping? Is there any way that you are helping?
It's also a very good question. When I was here last year, we had the opportunity to discuss with your Prime Minister Modi about what then called was the Modicare project, and now it is developed, and we offered to strengthen our embassy with an expert, especially on the Dutch health system, including aspects of the insurance policy. So now we have brought that expert to the embassy. He started working a few weeks ago, and I hope it can lead to a practical way of working together from both countries. And I'm for sure you are making such a very large transformation in this field. I think it is unbelievable what is happening here, and it should make your country very proud. And I take it as a compliment, because I think India is making major step towards, and I think that's good for the quality of life of all men in India.
Thank you, Minister.
Thank you.
Thank you, sir. Thank you.